Cardiac auscultation is a key clinical skill used to evaluate the mechanical activity of the heart by listening to its sound using a stethoscope. This test focuses on assessing the function of the heart valves and the rhythmic pattern of the heartbeat. During auscultation, the student should first identify normal heart sounds, S1 and S2, which corresponds to the closure of the atrioventricular and semilunar valves. These should occur in a regular rhythmic lub-dub pattern.
The heart is located within the thoracic cavity, slightly left of the midline between the third and sixth intercostal spaces. It's divided into 4 parts, 2 atria and 2 ventricles, and has 4 main valves. The pulmonary valve, the aortic valve, they are on the right and left sides of the base respectively, and the tricuspid and mitral valves located more ventrally on the right and left sides of the heart respectively.
Before auscultating, we first palpate the femoral pulse located on the inside of the hind limb. We use the femoral artery because it will be easiest to feel. This allows us to feel the heart rate. Use your index and middle finger because if you use your thumb, you'll potentially feel your own pulse. Feel the pulse bilaterally in order to determine if any blockages are present. Usually we perform this test for 15 or 30 seconds and then multiply to 60 to find the heart rate. Later, when listening with a stethoscope, also feel the pulse in order to compare.
Next, we perform the auscultation itself. We start on the left side of the thorax, with the dog standing or in sternal recumbency. Place the stethoscope's diaphragm against the chest wall between the third and sixth intercostal spaces, just behind the elbow. We listen at specific sites for each valve. The pulmonary valve at the third left intercostal space, just above the costochondral junction. The aortic valve at the fourth left intercostal space, slightly higher. The mitral valve at the fifth left intercostal space, just above the costochondral junction, slightly caudal to the others. Then move to the right side of the chest to listen to the tricuspid valve, located around the fourth intercostal space near the costochondral junction. When listening, note the heart rate, rhythm, and sound quality, whether the sounds are crisp and distinct, or if any extra sounds, murmurs, or irregularities are present. In a healthy dog, you should hear 2 clear, distinct heart sounds, la dub, with a regular rhythm and no additional sounds. The heart rate should be appropriate for the animal's size and condition, generally around 70 to 120 beats per minute in medium-sized dogs. There should be no murmurs, gallops, or arrhythmias.
Its primary purpose is to identify abnormal heart sounds, such as murmurs or arrhythmias, which may indicate underlying cardiac pathology. An arrhythmia may present as an irregular rhythm, for example, skipped beats, unexpected pauses, or heartbeat that speeds up or slows down unpredictably. A murmur, on the other hand, sounds like a whooshing or blowing nose, superposed on a normal heart sound. This occurs due to the turbulent blood flow, often caused by valve stenosis, the narrowing of vessels, or regurgitation, which is the leakage.
In dogs with heart disease, clinical signs can include exercise intolerance, coughing, labored breathing, syncope, or even acids in cases of advanced heart failure. Early detection through auscultation is therefore a key step in diagnosing and managing cardiac conditions. To summarize, cardiac auscultation is a simple, non-invasive technique that provides essential information about the heart's function. By combining proper technique with an understanding of cardiac anatomy and physiology, we can detect early signs of disease and monitor our patients effectively.